Hello everyone and welcome to Benzinga. We love sitting down with founders and innovators who are making an impact, and today we have a special conversation lined up for you. We're thrilled to welcome the founders of MNDR, Dr. Xiao and Dr. Rachel, to discuss their journey, vision, and their groundbreaking work that they're doing. So let's dive in. Dr. Xiao, Dr. Rachel, it's great to have you guys. Thank you for being here today.
Thanks, Kevin. Thanks for hosting us.
Thank you, Kevin. Thank you for having me.
Absolutely, guys. So would you mind giving me a bit of an overview of your company?
How we first started, right? It was back in 7 years ago. Both of us are practicing doctor. We run our own medical clinic. We each have our own medical clinic. So we are general practitioner. We talk to patients, we issue prescription, we follow up on chronic medical conditions. So at one point of time, both of us feel that care for the patients should go beyond the permanent premise of the clinic. When patients leave our clinic, we would want the patients to be able to reach out to the doctors, to their trusted doctors, anytime, anywhere. Be it in Singapore or when they travel, they should have access to healthcare. So we actually built this platform at a very rudimentary level 7 years ago, where patients and doctors just connect over the video consultation, the video call, and we issue a prescription and the medicine sent over to the patient. As we expand further, as we scale, we actually gain trajectory, especially during COVID. And even after COVID, we continue to gain significant feedback, good feedback from patients, where we are able to provide 24/7, almost instant care to all our patients over virtual consultation. And we also manage to deliver medications to patients' home within the same day and up to 4 hours delivery time. And now we are talking about Singapore, a small little island. And moving on, we are actually expanding to regional, to Malaysia and also Indonesia. And not only that, we also expand the reach to patients where they do not need consultation with our doctors. They only need to get OTC medication, over the counter medication. And that's where our pharmacists come in and join our ecosystem. Our patient is able to go into our online marketplace where they are able to purchase over the counter medication and also very highly curated healthcare products which are used by our own doctors. So in this marketplace, we do not list any just like any other products. Those products are highly curated where we use it for ourselves as well. That's where it makes it special. And on top of that, we have built various vertical business to support the entire ecosystem. We have built community of care where patients can share their medical issues with like-minded people. And we also have doctors as moderators to guide the patients to ensure that they get accurate information. As you can see, as we have Google, ChatGPT, OpenAI, all this AI technology actually provide a lot of important information. But how our platform make a difference is we have actually real human doctors to validate the information that is provided by the AI, OpenAI technology. So that's where we actually stand out from the rest for our social platform. So basically, I give a 5 minutes short introduction of what we do.
That's really great. So it
Thank
sounds
you.
like you guys really go up and above for your customers and for your clients. And that's great that you don't only have AI and OpenAI working with you, but you have the doctors to confirm that. Because a lot of people might get swayed when it comes to AI giving us answers, whereas a real doctor with real life experience, that's awesome. So while MNDR has achieved significant traction with patients and doctors, what are your other plans to further monetize the platform beyond teleconsultations? And what are the potential revenue streams we're exploring to enhance profitability and attract investors?
Thanks, Kevin. So, beyond telemedicine, which has been our core, we are essentially a technological company. The way we look forward is there are a few things. The first thing that if you're looking at is we come from the small island of Singapore. Regionally, we are going out to the islands of the country of Indonesia, Malaysia, Vietnam, and that is actually one area which we are going to cover and grow organically in terms of how you are bringing additional revenues and value to our shareholders. Now, on top of that, if you are looking at the way how we automate the whole processes of teleconsultations, bringing value to the doctors as well as to the patients, we intend to scale this model up. It will definitely enhance greater revenue stream. Firstly, a lot of processes will become almost automated, highly efficient. Doctors are able to do more with lesser time. Patients are able to be benefit more with much more efficiencies, meaning they are about to be able to spend more per patient per per year in our platform because of the way that we deliver care towards them. So we'll expect the amount of money spent per patient to go up, the efficiency of the doctor to improve. This kind of automation will definitely bring extra revenue stream. And of course, we will be moving from on-demand model to subscription models. Now, talking about that, we also have a lot of data that we're accumulating now. Now, a lot of this data will prove extremely efficient, useful to companies like pharma company, government-linked companies, and these are definitely huge potential revenue stream to us. We are yet to monetize a lot of this data source. Now, on top of that, we are working with a lot of corporations now. Insurance are actually looking for us as well, not just locally, but regionally. So, in fact, I would say, Kelvin, the way that revenue will come in is as much as our imagination can go. Now, the way that the revenue can flow in is also as much as how much we want to realize it. How will we actually operationalize? How will we actually move ahead with our target? Now, this is in terms of looking for new revenue stream, looking for how we are going to monetize our technologies and expertise. Now, what is even more amazing is internally, we are able to streamline our operation. We are able to exercise extremely fiscal prudent and efficiencies. And you can see that we are hoping that in the next 2 to 3 years, we are even able to achieve very good profitability down the line. Means we are spending less and earning more.
Wow, Dr. Sia, that is amazing, and I'm very excited to hear that. It really does sound like your company is growing and expanding, very healthy. So, as telemedicine continues to evolve, how are you leveraging technology and innovating to enhance patient experience and improve healthcare outcome and differentiate MNDR from competitors in this rapidly growing telehealth space?
Yeah, in fact, this is something that we are extremely excited about. Okay, now the way that we look at it is the future of medicine will be totally different from what we know today. We are charging forwards. We believe that the future of healthcare will be what we call AI-powered healthcare. It will be a healthcare where extremely powerful care assisted by AI will be able to deliver across the world. And we want to be in the forefront of this. You can imagine that I give a very good example, okay? In the third world countries where we hardly have enough doctors or enough doctor that's well qualified and well trained. But you imagine a world whereby MNDR is able to deliver this kind of quality care across developing countries. In overnight, at one stroke, you can elevate a lot of countries out of their poor healthcare status to that of a developing country or developed countries. That's because healthcare powered by AI has never been so powerful before. Now, before the age of large language model, we're talking about creating hundreds and thousands of algorithms for different kind of diseases and pattern. Today, gone is that difficulties. With AIs, in MNDR, we believe that we are able to deliver quality, efficient, affordable 247K assisted by AI at highly efficient rate, okay, across the world. That world actually, the dream of a world where healthcare is not equitable is no longer an impossible dream. We want to be at the forefront of this, charging forward towards this. And in fact, the way that we have been in NMDR, where everybody in the world, majority think that telemedicine is dead. Post-COVID, a lot of people are actually coming downward. We are doubling up, okay, in terms of developing a platform that's highly efficient, that's highly scalable, that can be easily deployed to bring about equitable healthcare. You can imagine now when you interact with me, AI can solve lots of this early triaging, picking up abnormal signs and symptoms, extremely powerful in terms of remote analysis of your facials, diagnostic, without any context, okay? Now, that can be done in the next few years, easily achievable through AI. And you can imagine that standard of care can be highly elevated, you see. And at the end, it just what is left with is for the doctor to validate all this, and boom, you deliver the good quality care. And that is amazing. And we are already getting that because the way that we have transformed healthcare for our doctors, now a lot of them do not have to write any script. A lot of them, even the coming months, do not have to take down physically many measurable reading. Because as I talk to you, the AI should be able to analyze your facial movement, your eye movement, your respiratory rate, and give me all the data. So I can deliver care in 5 minutes instead of traditionally 30 minutes. And I can deliver it to more people. And that is powerful. And for the patients, we see a world that is simple and idiot proof. Today, I have to take out my phone. I have to key in my information. In months and years to come, you just need to flip out a phone. You're talking to what we call our AI agent. We may want to call it our K agent. You just talk to the person as it's in your own languages, mind you. You can talk in any languages. The AI will be able to interpret it and translate it to another language that your provider is familiar with. You can imagine how powerful is that, you see. Effectively, I am able to talk to somebody with 200 different languages across the world, which at present, even the very best of the doctor could only speak in 5 languages or 7 languages. Most of us speak in 1 or 2. But we envision a world whereby I can speak to any patients of any languages. And AI is able to do that now. We are just dreaming of a world how we assimilate all this. So healthcare become extremely simple and idiot-proof for anyone who want to seek healthcare. And for any doctors who want to deliver healthcare, it'll be highly efficient, effective, and highly expensible around the world. And that is the world that we see coming. And we will charge forward towards this. And you can see how much revenue is that. To a country that's short of doctors, I can use AI to deploy thousands of doctors with a few doctors overseeing the whole processes. That'd be a highly effective world where we live in, where healthcare, everybody should enjoy almost the standard of healthcare. You know?
Yeah, no, I agree. Healthcare should be something that everybody should have access to. And you've made some great points, Dr. Xiao, how with AI and with obviously the internet evolving, we're not only able to reach more people, but to be able to translate it. So you don't even need a doctor that speaks the same language. All of those points are fantastic. And to think of a world like that, it's very possible in the near future. Now, I want to stray a little towards your stock. Now, what are you doing to stay compliant with the NASDAQ and to raise your stock price over $1?
I think the many steps that we're taking The first thing is because we are small cap companies. So Dr. Teo and me has been relentless in this pursuit. Okay, we attended almost any investor meetings that we can grab hold of across the countries in Americas, Canada's, as well as Asia Pacific. The first thing we want to make sure is more and more people, and even for you guys like Benzinger, we are really thankful because it is through all this media people start to know about us. We have met good friends who comes in who believe in our visions and our goal, and they'll start to support us. Now, I think key is to have investors, institution investors, or even retail investors, family office, who believe in our vision, who comes in, and bingo, the share price will be supported. In fact, it will shoot up. But of course, now we unfortunately there's not enough people that know about us. Although more are beginning to find out more about us. So you can see that the share price is languishing at below $1. So we have actually filed for reverse splittings of 8-1, and that should come through in the next couple of weeks. Now, a lot of people will say that's negative news, but to us, this is news important because this is the very first step for us to make the compliant before the world know us. And as we meet the compliant, there are many other steps that we have already taken in place. The first thing is, if you have heard the news that we have actually managed to raise a 10 million capital loan that's going to support our growth, expansion regionally, making potential M&A, as well as further enhancement to our IT and development in AI. Now, these are positive news. These are news that will support post-reverse splitting. And of course, the company has other plans in terms of potential acquisition, merger, and target that will bring in further revenue. And not only that, in terms of our own organic growth, our relentless pursuit in terms of growing to the neighboring countries, our relentless pursuit to look for every possible revenue sources that will comes along our way. We think the share price will ultimately go up, reflecting what the value of the company is. In fact, we dream of the days where our share price will never have to go down below $1 and it will always stay above, and maybe even achieving the status of a company that have billions of market value. Yes.
Dr. Xiao and Dr. Rachel, what is the biggest trend at the moment in telehealth?
Yeah, Kelvin. In fact, we believe that telehealth will be the mainstream of healthcare. This is because, unlike traditional telehealth, where I will speak to you face to face by virtual communication, no. The telehealth of the future is one where it is powered by AI, augmented by AI, and it will be so powerful that it actually can predict, preempt, deliver comprehensive care that is unimaginable, allowing remote contactless diagnosis to be simultaneously carried out. That is the world where telehealth of the future will be. And Maladoc want to be there to usher in this renaissance of healthcare. In fact, we look at it as a renaissance in healthcare. The golden age of healthcare is here today because of AI, powered telehealth. Yes.
Wow, you're absolutely right, Dr. Xiao, and I couldn't agree more. A huge thank you to both you, Dr. Xiao, and Dr. Rachel, for joining us and sharing your insights on MNDR. It's always inspiring to hear from the founders who are pushing boundaries and making a real impact. Thanks for watching, and we'll see you next time.
Thanks a lot, Kevin.
Thank you.